I hope you and your loved ones are well. My name is Mari Watanabe, and I'm the Executive Director of Partners in Diversity. Today's equity conversation topic, healthcare inequities in the workplace, is part of an ongoing series where diversity influencers like you can engage in meaningful conversations. And through these conversations, we hope to inspire you to make meaningful changes within your own organizations. So joining me now is our Director of Programs and Communications, Tracy Lamb, to tell us about upcoming events. Tracy?
Thank you, Mari. Good morning, everyone. It's great to see so many of you here today to better serve you, our members, and offer timely and important resources during this extraordinary time. We have committed to bringing you at least 2 programs each month, and many of the topics are based on feedback from you and other community partners. So be sure to fill out the survey at the end of the session so we can better serve you. So here is a look at the upcoming programs. On November 13th, our ongoing series, Breakfast for Champions, will focus on budgeting for equity and how leaders can shift their financial policies and processes using a racial equity lens. On November 18th, our equity conversations topic is on internalized racism and imposter syndrome. This is specifically designed for employees of color and provide them a safe space to discuss this topic. On the 24th, we are taking Say Hey Virtual. Our signature networking event took a hiatus because of the pandemic, but we're now ready to bring it to you virtually thanks to Oregon State University. If you know of a professional of color who recently relocated into our area in the last 18 months or so, please have them visit pidsayhey.org. In addition, we are recognizing the new professionals of color in town. We're also providing a goodie bag. So if your organization wants to donate a digital gift to the honorees, please email us at sayhey@partnersindiversity.org. And for those who like to plan ahead, like me, in December, we are welcoming nationally renowned diversity consultant Jennifer Brown to Breakfast for Champions. She will share her thoughts about inclusive leadership. On December 16th, we are hosting the CEO Forum, a biennial convening of CEOs, presidents, and other executive level leaders to share challenges and explore solutions together. The member liaisons in your organization should have already received invitations to those. If you haven't, definitely look for those in your inbox or spam box. And for those who use our online jobs board, I'm really excited to announce that we are upgrading our career center. Beginning next month, you'll notice a new look, have access to more functions based on feedback from you, as well as an improved user experience. One final note, today's event is being live captioned by LNS Captioning. To activate that feature, simply hover over the bottom of your screen where you'll see the CC icon. Click it and you'll be able to access the captioning options. So that's it for me today. Thank you so much again for being here. Mari, back to you.
Great, thanks Tracy. Yes, we have a lot going on all to hopefully help you improve diversity, equity, inclusion in your workplace. So the coronavirus pandemic has exposed and widened the healthcare inequities that already exist in the workplace. It has also brought to light the role that an organization has in supporting employee health and well-being. You may be thinking, but we have health coverage, paid time off, and family leave. But some of you might even have workout facilities or yoga studios in your workplace. But now think, are these enough? Who is actually accessing these benefits? If not, why? What are the cultural, racial, social, and structural factors at play here? Today's Equity Conversations topic of healthcare inequities in the workplace will explore the efficacy of current health benefits for employees of color and what employers can do to close the gap. We also hope that it will challenge the way you think about health. To lead us in this discussion, we have 2 experts I'm very happy to have here today. Toc Soneoulay-Gillespie is a 1.5 generation Lao refugee born in a refugee camp in Thailand. She resettled in the US with her parents in the late 70s, shortly after the secret war in Laos. She holds a master's of social work from the University of Alaska, Anchorage. Toc was appointed by Governor Brown to serve as commissioner on the Oregon Commission on Asian Pacific Islander Affairs and as a council member of the Governor's Behavioral Health Advisory Council. In her current role as Social Services Manager at CareOregon, she works to identify opportunities to collaborate with community partners, relate to social determinants of health strategies that promote health equity, and improve health outcomes for historically marginalized communities. Prior to this role, she served as the Director of Refugee Resettlement at Catholic Charities of Oregon. And I'm also pleased to welcome Denise Johnson. In her current role as CareOregon Health Equity Advisor, she provides strategic guidance and support to CareOregon staff across all lines of business and departments to coordinate efforts to concretely integrate an equity, diversity, and inclusion perspective across all CareOregon operations. Denise has a master's in public health, 20 years of experience working collaboratively with diverse communities in the advocacy, planning, implementation, and access of programs and policies to improve community and individual health. So I'm really pleased to throw this over to Denise. Take it away.
Good morning, everyone. What a privilege it is to sit with you this morning, this nice Wednesday morning, 9 a.m. early. Again, my name is Denise Johnson. I'm the Health Equity Advisor at CareOregon, and I use pronouns she, her, hers. It really is an honor to have this time to sit with you to help explore what more can we do for our employees of color in this very unique time called COVID-19. We've had the privilege to kind of work through those issues at CareOregon and want to share some of those experiences with you. But I also want to pivot now to my colleague, Toc, who will be co-facilitating this conversation with me. Toc?
Good morning, Sabaidi. Thank you again, Mari, for inviting us. I'm so stoked for this conversation. Again, my name is Toc Soneoulay-Gillespie, and my pronouns are she, her, hers. I'm the social services manager, as Mari mentioned, but what that really essentially means is that I get the privilege, right, to support and facilitate a lot of the conversations that happen between community and the health system, the very big and complicated health system. And I also get to work in and around our housing efforts. So that's pretty exciting for me at CareOregon. And just full transparency for folks, I don't come from the healthcare field at all. So this is all fairly new to me. So I'm, again, so thrilled to be here. Thank you, Mari and Tracy, for having us.
So next slide. So this will be a fun activity. I'm excited to see the results of this activity. So we're going to jump into the conversation by starting with a storm cloud. And so you are challenged to pick one word that you personally use to define health. What would that be?
And for those, are you going to pull that up, Tracy? Do you have it? Oh, I can see it now. So for those who are wondering why we're using Jonathan Weed, this is actually a legit account. We didn't steal it from anybody. Jonathan Weedman is the vice president of our population health department at CareOregon. And we at CareOregon are always striving to leverage existing resources as opposed to duplicating efforts. So instead of creating a whole new account, we're just going to use Jonathan Weedman's. As a matter of fact, right? We're a Medicaid, Medicare serving organization. And how do you say it, Denise? We're a, what is it?
Wise stewards of public resources. So we're not going to overspend.
So talking to Denise, do you want me to jump in here and walk people through this program? So we are using a program called Poll Everywhere. if you've ever used it in the past, you know it's really simple. You do need a smartphone to participate. If you don't want to use your smartphone, you can still participate by using the chat box. So I'll walk through the cell phone situation first, and then we can get to the chat box. So grab your smartphone and open up like you're texting somebody, so a new message. And in the to column, enter 22333. When you're there, move down to the message section, so where you would normally write your message, and type in Jonathan Weed 693. Jonathan spelled JONATHAN WEED and the numeral 693. And then you hit send. And once you do that, you should probably in 30 seconds or a minute receive a text back with a link. And it's a link to Poll Everywhere. So click on that link. And once you do that, it should take you to a screen that says get started. So just click on get started. And the next screen, it'll ask you whether you're a presenter or participant. You're a participant. So click participant. And then you'll get another screen. I'll ask you for the username. The username is actually Jonathan Weed 693. So plug that in, Jonathan. I keep spelling Jonathan wrong. Jonathan Weed 693. And then hit join. Then you should have a box that says, using one word, how would you personally define health? So go ahead and enter your responses. And for those who are not using your smartphone, feel free to enter your one word into the chat box, and Dorothy will enter that on your behalf into the Poll Everywhere cloud. So if you'll give me one moment, I'm going to switch over so we can take a look at that poll as you're entering that.
Thank you, Tracy.
Yeah.
I've always been on the other end of Poll Everywhere, but not on this side of it. So it's pretty cool to try this out this morning.
And to see
So-
it be creative.
So you should start seeing the poll now. So talking to Denise, I'll let you kind of talk us through that.
Yeah, we see it.
So I was told that the more frequently a word is used, the larger it becomes. So to me, that really begins to represent what people are seeing or feeling aggregatedly in terms of how they are defining their own health. Kind of fun to see. I like that word robustness. Well,
I was so happy to see human made it in there.
oh, freedom.
Ease. Excellent.
Equity, I appreciate that. And Tracy, will this be shared out with people in like the notes that people will be able to print out and keep?
I think so. I think I should be able to save this.
Okay, I'd love to be able to.
It's not my account, so we may have to ask Jonathan.
Oh, that's true. That's true. Well, that would be an easy ask. That would be an easy ask.
It'll be an easy ask.
Yeah. Happiness. Breath. Wow.
Wow, thank you for
Fair
that,
enough.
everybody.
Yeah. Maybe we want to take a few more minutes.
Right.
Balance. That's a great word. Maybe 60 more seconds.
Just out of curiosity, how many folks have played around with Poll Everywhere before? I see you, Mari. Is that Ricky? Am I reading that right? Olivia? Barry? Is that Barry?
Let me know when you want me to switch back to the slides.
All right.
Hey, I think that's good. Go ahead and switch back, Tracy. Thank you, everyone, for taking the time to share the words. These are great words. So just want to talk a little bit about our time together, that it really will be an opportunity to share information and an opportunity for some reflection. Toc and I are not going to be talking at you. We really want this to be a co-creative type of conversation where we'll really be engaging with each other. So if you haven't already, go get your coffee or tea. I have my tea or water or whatever morning drink that you would like to enjoy, and to sit back and to really enjoy this time together in this conversation. We all have wisdom. We all have experience, and we want to draw out that wisdom and experience and learn together. So for the next hour, what we're going to briefly do is talk a little bit about CareOregon, about who we are. We want to talk a little bit about the factors that impact health and health equity. And we want to and challenge you to look at your company policies and your benefits and to explore the efficacy of employees of color and compare that to traditional healthcare concepts. And then to talk about and look at systems. How is your system responding to change this COVID time? And what can we do to influence those changes? And we invite you always throughout this conversation to type in your questions and your comments and your chats. And feel free to raise your hand. Your input is valuable, and we look for that. We hope that you leave this hour invigorated and challenging yourself and going back and challenging your organization to look at the wellness of your employees and particularly the wellness of your employees of color.
Yeah, this is weird, Tracy and Denise, like, we're just like talking at the screen. I mean, we do this often, right? But at the same time, every time I'm just like, ugh. So I'm one of those people who's very interactive. I want to see faces. I want to see like comments. So if you're feeling courageous today, please just jump in. I see you, Simone. I see you, Sandy. So to kick us off, I think it's important to call up, right? As the amazing Van Jones, the news commentator, attorney, when he says call up. It's not call out, but it's to call up, you know, the fact that there are inequalities in healthcare and healthcare access. When Dr. King said this phrase many, many years ago, who would have known that it would still painfully ring true today in 2020? While there are folks working on systems change, we'd like to ask you as employers to think about how you're part of this movement, right? Think about what you're doing to ensure and encourage employees of color to access and leverage the benefits that they're paying towards, that they have.
So CareOregon, what we do and who we are. So CareOregon, for over the past 2 decades, has focused on quality healthcare and providing access to a broad provider network. We serve Medicaid population. We have a population of over 250,000 currently, as well as the Medicare Advantage program, where we're serving about 12,000 duly eligible Medicare and Medicaid enrollees across 6 counties in the state of Oregon. So we want to talk about this first concept that maybe some of you are familiar with. It's called the social determinants of health. And we're going to use this to guide our conversation and to kind of level set around health equity and the factors that impact health equity using the social determinants of health. So Tracy, if you hit the button, I think it will scroll in the definition of what that is. So the big, broad definition shared by the Healthy People 2020 is social determinants of health are conditions and in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and the quality of life, outcomes, and risks. So that touches every area of an individual's life. So it's really saying that health goes beyond the 15 minutes that we might spend in a doctor's office. It affects our neighborhoods, our economic stability, our educational access and resources, and our social and community networks. An example I like to share is I do a social dance, and I know Vicki is on this call, so she knows about this. It's called Chicago Stepping. It's a swing dance, and we have a couple in our community, an older couple, they're in their late 70s, early 80s, and the gentleman in this couple has Parkinson's disease. We're really his support and his family. And we noticed that during this COVID time, when we weren't able to gather and weren't able to dance socially, that his condition began to worsen. But because we are a knit and close community, this couple has reached out to us. We continue to make access and ability to kind of, in a very small group, safe setting, dance. And as we came together and began to dance more, his condition and his symptoms began to ease and ameliorate. So the importance of having a strong social capital and social and community context really was evident in improving his health.
I'm curious, Denise, with the group, like when you see this definition, right, social determinants of health, like what does this mean to you all? I'd love for folks to unmute if you feel comfortable and chime in, because English is not my first language, right? Lao is my mother tongue, and I'm constantly living in two thought worlds. And I'm fascinated by the English language. Like we use a lot of jargon, right? We say social determinants of health, and we assume that everybody understands that. So I'd love to hear from folks, like, what does this mean to you? Like Denise's example is a beautiful one, right? Let's take that textbook definition out and share what comes to mind when you think of this, because it's used a lot in the healthcare field. Erica, I see you.
I think I would share that it's interesting because for me, it feels like this isn't far enough. I think when I think about like the systems of oppression, I think this is as far as we are. So for me, like that's the immediate like reaction that I have to it, but this is better than what we've been focusing on. And also understanding that the interplay of oppression and how it shows up in these characteristics that affect a person's life. So it's just like all the factors that either set us up or for health or set us up for unhealth, disease, or death. And so
yeah, thank you. I see some chats here. I'm not great at multitasking. I see Vicki and Denise are saying hi to each other. It's fantastic. Love it. How social groups impact health, both physical and mental. Is it Jetamio?
Yeah, Jetamio.
Oh, Jetamio. Thank you for that.
Yeah, no worries. I go by Jay. So.
How many of you have heard social determinants of equity? That's a new one that's coming out. But again, though, like we have these terms, but what are we doing about it, right? In my role, I get to go out to community and really talk, particularly with our communities of color, about what we're doing to support our Medicaid and Medicare members. And when I talk about this term, I was out at one of our events with our Black community, and one of the gentlemen said to me, he says, wait a minute, for years we've been telling health systems that I'm not concerned about my diabetes. What I am concerned about is how to pay my rent, right? How to pay my utilities and the crime and the violence that's in my neighborhood. Like, that's what I need help with. Right? I don't want to talk about my diabetes or my ear infection. But now you all are coming back to tell us that it's been coined social determinants of health. And I was like, yeah, it has been coined social determinants of health. What you've been saying to health systems all these years are now just finally, being looked at differently. But what did it take? It took researchers to take this concept that communities in poverty have been saying for all these years, coined it social determinants of health, and now it's legit, right? Health systems across the country, and my healthcare colleagues, my brothers and sisters on this call chime in, right? Like, we are now investing money on the front end, right? We're using words like, let's invest on the front end and go upstream. Let's address social determinants of health. And communities of color have really said, this is an insult. So I want to just put that out there and share with folks that we share this to say, yes, here's this term, but let's now unpack that together. What does it really look like? How does it show up in practice?
So I like, before we move to that slide, I would just like to take just one moment, Toc has kind of led into that, but to really look at this introspectively. So looking at these 5 components, look at your own factors. What element and factors within your own life are being affected in any one of these areas? And feel free, if you're comfortable, to share that in the chat box or to unmute and share your experience. So again, where's your health being affected in any one of the 5 areas currently? And then as well, what are you doing to support your own health in any one of these areas? I shared the experience about the dance community, and that's really been a source of help for me during this time. Are there other things, maybe in education, or things that maybe you are doing in your neighborhood communities that are supporting your health during this time?
Oh, Sandy just threw out some percentages and some data for us. Yeah, you're right, Sandy. Not everyone is getting that same level of care, and we're not doing enough for our Black and Indigenous people of color communities.
So Toc, you want to read that since you're responding to?
Yeah, Sandy said recent studies show that 44% Latinx, 37% Black, and 44% people of color have symptoms of COVID with limited accessibility to healthcare. What systems need to change to make general healthcare more accessible? Equity is not everyone is getting the same level of care due to socioeconomic problems. There aren't enough Black, Indigenous people of color counselors to address the mental health pandemic that now occurring. And we'll get to that. Oh, we will talk about equity later.
Yep.
Do folks feel comfortable unmuting and sharing with us what factors in your life that affect your health? We love faces, we love voices.
Yeah, I could speak a little bit to my own experience. I'm a trans man of color, and I kind of always have to toggle the difference between my employer's insurance. So, for instance, I worked for an insurance company for a school who had an insurance that wouldn't allow me to get health care for my surgeries, the surgeries that I would like. And at that time, I think it was like Providence, I think. And so through a loophole, through the equal, opportunity employer, I was able to get my health care through that. So I think for me, it's one of the first things I think about anytime an employer switches healthcare, and whether or not, especially with the current, administration, whether or not I'm ever gonna you know, whether I can or my wife can get healthcare, you know, I mean, at any given moment, and whether we can get healthcare for our family even, you know. So kind of always trying to check the administration in place and seeing, you know, how they feel about that, you know. So I'm always looking for somebody else to tell me that I can get healthcare, which
Mm.
seems really hard to accept.
Mhm. Mhm.
Yeah. Thank you,
Thank you
Jay.
for sharing. Yes.
Yeah.
Yeah.
So we have an employee assistance program, and we've had some incidents in Hillsborough against some of our employees that have indicated racism or sexism that have occurred against them by the public out in the workplace with field kind of workers who are out in the field. And particularly dealing with racist incidents, having access to an employee assistance program where the providers can actually speak to that issue as opposed to general counseling services, and trying to explain to our HR, very understanding people, but explain to our HR the importance of being able to access that kind of culturally specific care.
Thank you, Simone. Hi, Vicki.
Hello. You know, I wanted to mention to the group that there's such a shortage of practitioners of color in Oregon and Southwest Washington and probably the rest of the country. But I don't know, it's a long-term initiative to correct that, but there are very few mental health practitioners or even, you know, physicians of any type of specialty. So I think that has to change in order to change the equity and access to service.
Thank you, Vicki. It's very true. Kind of piggybacking on what Simone had shared, our HR department had shared or was publicizing access and encouraging people to access the EAP service. And I asked, do we know how diverse that population is, so that if there are employees of color who would prefer speaking with someone of a person of color, they would know that. And they didn't have that information and weren't sure how they could even get that information. So these are some of the barriers that as employers we're up against, coupled with a shortage of having mental health providers. There's several hurdles. Anyone else would like to share? Okay, next slide.
What do you call this, Denise? Pregnant pause?
Pregnant pause, yeah.
Oh, who is that? Simone? Oh, do you have a preference for people? I would so appreciate if folks could turn on their camera, but I also know that that's not always possible for a variety of different reasons. So I want to make sure that that's out there as well. But yes, love to see folks' faces. Because again, this is, you know, I'm like, how do I do this? And where I come from, we're very relational, right? This whole transaction of like, who's next? Raise your hand. It's throwing me off. I need to hear like, yes, no, that's not true, right? Like, there you go, Juliana, I see you. I want to go back to what Simone mentioned and others in the chat just about culturally specific. I think, again, that term gets thrown around quite a bit. And I think there's opportunity there to ask our employers, like, what does that really mean when you say culturally specific, right? And even linguistically specific. Like, I think organizations have to be able to understand what that looks like and be able to articulate that. I think sometimes those words are very transactional and we say it and then we move on. It's like, no, hire people who are from communities of color, who speak multiple languages, right? There's so much to be said about being someone of color and connecting with a therapist who is of color. There's just so much that you don't have to explain, right? I could just say something and that person in so many ways gets it. Oh my gosh, Rika, Kathy, Olivia, hey. Thank you for welcoming that, Simone. I didn't have the courage to be like, come on, everybody.
Yes. Yes.
So yeah, like I just, you know, how many of you in your organizations are actually defining what culturally specific is, really being bold, right? And not skirting, like in the Western culture, right? In the traditional white healthcare system, we do a lot of like, what is that called? Dancing around, you know, it's that culture of niceness, right? That's just code for I don't see color, right? So I want to just put that out there and be like, how do we courageously, how do we all channel Dr. Brene Brown, right? The shame researcher, my intellectual crush. How do we channel our ancestors, those who really paved the way for us? I often channel them for strength when I talk about this topic because it's hard, right? It took George Floyd to be murdered before I felt comfortable being able to speak in a very white organization. So I'm being vulnerable. Hi, Sandy. You know, to come to you all and ask you all to help me as well, like talk through this. Let's help the group talk through, like, what do we mean when we throw out these terms? And because if you don't understand the why, I think it's really hard to implement anything, right? If you're not invigorated by this, if you're not angry by what's happening, how do you really make change? What was my question?
I think the other issue is, you know, use the term dance around, which is generally not comfortable having conversations about race in general. And then when we acknowledge, at least intellectually, that we do need to have conversations around diversity, number counting, as I call it, and inclusion, really allowing people to participate, it's often directed outward in our organizations versus internally. And so this, as we look at employee benefits, is an opportunity to look internally. Are we being intentional about the type of policies and benefits that we are developing for our employees with a true eye towards equity and the needs of our employees of color or language?
It's a great segue. I know, I don't know if it was Simone, it was a few other folks who mentioned EAP, right? What other things? What other supports that you currently have in your organizations?
This is Sandy B, because we're in mental health and addiction. And so we're rolling into our DEI programs, issues of racial trauma, which specifically addresses the racial trauma with Black people. And so we've been having some pretty open conversations with our Black employees regarding that, because it's an area that's not addressed, and there's day-to-day trauma that happens in the Black community that other communities may not be aware of. And so we're rolling training into our DEI programs to build awareness of racial trauma and what that is. So in a sense, it's a benefit that if it raises awareness, then we know that that's an issue, and we can start training our counselors to address racial trauma specifically. So it's a continuum on awareness, and working in a company such as that has been a real eye-opener for me. So when you talk about employee assistance programs, there's a deficit there because many of them don't understand this particular area or don't have the consultants for it. So we've had to take it on ourselves. So we do a lot of work with OCBH, Oregon Center for Behavioral Health, and they have these fabulous webinars addressing those issues. So this is, and then we do a trauma-informed care approach to it. So it creates a very safe space for everybody to have those conversations, because what we've been hearing is that these can deteriorate quickly if they're not addressed appropriately, and you don't want to have it to be divisive. So there's a gap there in the DEI programming that we're trying to address, and hopefully that can be replicated elsewhere. It's unique, but it's not unique because trauma happens every day. It's happening all over the place right now. It's like this thing that we have stats on it, but nobody really talks about it as much as it should be talked about.
Sandy B, I'd love to know, like, can I ask, what has been the feedback from your, from the folks that are participating in that?
Well, they're glad that we even recognize it. You know, I mean, it's like the fact that you recognize that this is an issue, then we can start working on that. It's an issue, but it's great to have a forum where I throw it out, and if I'm talking to a Black employee, they'll just open up about it. And so it has to be in a space where it's comfortable for everybody to have that conversation and it doesn't get divisive. Because if it gets divisive, then you lose the engagement, right? And then it starts deteriorating from there. So yeah, it's like, wow, somebody actually understood what's going on in my universe every single day. Because as a white person, I don't have those triggers every day, right? So, but a Black person is going to get triggered every single day with the protests and all of that go on.
I would love to build on that. Sandy, thank you so much for sharing that. So I'm Rika and I work at Peace Health, and after George Floyd's murder, we really recognized very quickly that we need to offer additional support, particularly to our Black caregivers, our employees, but at large to our caregivers of color. So we started a new service, which we call the Culturally Responsive Psychological First Aid, which is an internal phone line that our caregivers can call and schedule an appointment free of charge with a counselor of color. And then that counselor will do an assessment of what are the other services that specific employee would need at that time. And as we started to dig deeper, our employee assistance was not equipped to offer referrals to counselors of color. They didn't even track it. And when we further dug deeper, they didn't have any of them available. So we work with our EAP specifically, separately, to add counselors of color to their portfolio. But something else we noticed was that because typically EAP programs don't pay that well to the counselors, we had to make additional negotiations that these counselors of color, we wouldn't ask them to undersell their services. So that was additional equity aspect that we had to pay attention to. So that phone line and the appointment line has been quite widely used. Then the second layer was that we started the Healing from Racial Trauma group therapy sessions, which is a free 8-week group therapy session for our Black, Indigenous, and people of color employees. And we have our leaders and our employees taking part on it, and we are starting a next cohort recruitment relatively soon. So those are a couple of services that we have put in place in the context of behavioral health.
Great, that's great work, great work. So Sandy B, there was a request for the name of that organization that you referenced. Can you put that in the chat for us?
Were these groups established after George Floyd's murder for you as well, Sandy? Sandy B?
It was, well, when I came in at DePaul, I've been there for about a year. We just needed to revamp our DEI anyway. But what was a real eye-opener for me, I've been in the field for a while, but the whole George Floyd thing and everything the fallout from that was a real eye-opener for me when I started talking to my Black colleagues. there was issues that they weren't talking about before. And then the racial trauma came up. So I was like, okay, I just feel totally stupid now that I didn't get that piece along the way. It's things to pay attention to, because it's like, why is there violence? Why are they tearing down statues? Why are they doing that? I'm like, well, as a white person, I don't get traumatized by that. You know, I'm not saying it's okay. I'm just saying that as a white person, you know, anarchists come in and do their own thing, right? But as a white person, I don't feel the same level of trauma. So when you question why, you know, we're going into name changes on football teams or anything else, it's like, you don't live that trauma. So until you can internalize and understand that trauma, then you can have more empathy as to why people are making those decisions.
Thank you. The reason why I ask that is because, you know, it takes something that painful for organizations to take their slogan to the next level. What I'm hearing, what I think I'm hearing from both Sandy B and Rika, right, is that you didn't just have a slogan, but you're investing time and resources into making sure that your staff have this as a part of when they show up to work. That's important.
One resource and experience that I'd like to share is that recently, CareOregon, about 163 employees engaged in this training. The training is called Whiteness at Work, and it's offered by the Attaway Group. They did a 1 hour, their first module is on YouTube, and it's free. And then they do a summer series, which we participated in July. They have recently made that series available on demand. It's about an hour and 15 minutes, but it's really directed towards our white coworkers to really get a better understanding of how whiteness shows up in the workplace. And so it gives you an opportunity to see all the frames and the structure, and then to begin to have a conversation around how do we go about dismantling that behavior and those structures. So even though employees, and I participate in, employees of color certainly are welcome to participate, they are very frank and open about if an employee of color is being triggered, feel free to back off. But I found that a lot of learning and good has come out of that from my white colleagues, and what we are taking from that is having debriefing series, which are going on now, where they're taking those learnings and how has that impacted me individually, and then how can I take that to my team work, my department work, and then how can we begin to roll that out organizationally. So I'll put that information in the chat. Again, the cost was extremely reasonable for what you're receiving. And again, the first module is free, something that you can look up on YouTube.
I was going to mention that later too, Denise, so I appreciate you bringing that up now. It was an investment that our organization made that I was actually surprised about. And I took away quite a bit as well, right? We use the word white advantage, white supremacy. Again, are we understanding how that actually shows up at work, right? They talk a lot about power structures. You know, they talk a lot about really examining the things that are happening on a day-to-day. And they also give us tools on how to name certain things that are happening. And Denise, I also appreciate when they said, you know, for our Black, you know, brothers and sisters and other communities of color, like, you don't have to be here.
Yeah.
They really gave us permission to not have to be here or even speak.
That's one of the things. So we did Whiteness at Work last year. I think it was the summer intensive series. And we actually did it with leads and with managers. And so it was a little bit mixed. And I think in the middle of that, we started to realize just like the different experiences between the white presenting or white folks and the people of color. And so it's been an interesting thing. So this year we transitioned more into affinity groups. And so we have white caucusing. So they're doing white supremacy in me this year. So they're doing all the journaling, and they did it over the summer, and then meeting every week to kind of process through with each other so that they didn't affect other people. And then we've been working or trying to focus more on like, what does it look like to support like people of color and Black employees, which could be different because of how pervasive anti-Blackness is. And so it's been an interesting thing, even though we have these employee resource groups where it's more of a social and a supportive environment. It's the people of color group. But even then, like we were talking about like the efforts that organizations or even our organization are doing, like we have to acknowledge that there is possible that there's no safe space for a Black person in an organization. Like as much as we want to think there is, or as much as we want to pretend like we're creating a space, like we don't honestly know, depending on what kind of trauma they've encountered even in our organization before we decided to start doing better. And so we've been kind of running into that of like, so I really appreciated the information around what does it look like to connect groups internally outward with resources. So with the Peace Health example was really helpful to think through that of like, just because I think I'm safe or just because I think I'm woke doesn't mean that people should trust me or have to give me any more information than they feel comfortable giving me. And as an employer, I have to approach it that way. Otherwise, I'm perpetuating violence against people.
Exactly.
It's hard because I'm trying.
Yeah. I think we're all trying, right, Erica, me included. Right? I had the courage again to speak up in one of our other meetings, and I finally said, you know, I often feel like a spy when I show up to our meetings. The way they're set up, the agendas, we got to fix time, got to make sure we're following the time, you know, and then right up 5 minutes before the meeting's over, we got to have a next step, right? It's like that is white advantage and how things show up. And I'm always sitting there going, oh my God, do I belong here? Right? Because the things that are how we show up at work, it just doesn't fit how, you know, it's the majority for sure. But those who don't always feel visible or their voices are elevated do feel like a spy. And a spy isn't a bad thing.
I often feel that. If I'm honest, there are a lot of there's some groups where I don't feel comfortable sharing my camera. I don't feel comfortable, you know, doing those things, and I think it's because the perception, right? Sometimes I'm, you know, probably one of the only people of color on a call, and it's this feeling of you're being watched, but you're not being watched. You're being assessed to see what your response is going to be, what your feelings are going to be, what your facial expressions are. I'm really sensitive to all those things, you know, because they could be distracting. You know, they could be distracting for the learning that should be happening. And so that really spoke to me.
Appreciate that, Jay.
In the healthcare setting, there is this one additional layer of hurt that comes from our patients and our visitors. So we have seen an increase in hate language and discriminatory behaviors that our patients are expressing towards our caregivers of color. And what is that experience like, especially now during this election season and after, of, you know, being afraid of white supremacy violence as an employee in healthcare setting? So we have connected this culturally responsive psychological first aid as a part of that process, that when our employee hears some racist slurs or discriminatory xenophobic slurs, you know, from the patients, that then they have that additional support to process it with somebody, so we don't leave anybody alone to process it and say, you know, just walk away by dealing with the patient, but not supporting the employee.
Thank you.
Thank you. So I want to move our conversation on. Thank you for changing this phone. So let's talk about the current environment we're in. We all know it seems like it's been in the news since February, March, that we are seeing the impact of COVID-19 upon our communities of color. And then this is recent information. The Oregon Public Health Division publishes this every, I believe it's every Tuesday, these numbers come out. But it does show that within our state, communities of color are disproportionately being impacted by COVID-19. There are a lot of factors that contribute to that. There is the overlay of health disparities already being experienced by these communities, but we add discrimination, the housing, economics, occupation, and then access to healthcare. But then, as we have been talking about, how are our employees of color using their employee benefit programs? So we want to give you an opportunity to really talk and to assess or perhaps even reassess your employee benefit programs. Go ahead and filter that in. So what does it really mean to use an equity lens? And Tracy, you can bring those, fill in the slide.
If I may, Denise, I'd like to offer a little bit of my understanding of equity. But before I do though, I just want to ask, like, again, this is another jargon term, right? Who can share with me, like in very plain English, what does equity mean? Such a jargon, but it's big, it's loaded. There's a lot of experts in this room. I'm that one person at CareOregon's always like, can we do a level setting of what equity is? And people are like, oh, geez, talk. But again, I think that's so important, right?
I would agree with you. I'm in a field where I'm a pretty new professional to my line of work, and I did not come with a significant level of schooling that set me up for this. So it's kind of like, you know, make the plate spin, you know? So there are tons of times, even with the VP of my org, where I have to sit down and be like, I need you to break that down for me. You know,
yeah.
Because I don't think it's safe to assume, right? I think it's about that assumption again. So
I'm sure all of you have seen or most of you have seen the photo of the baseball field, right? That defines equity. I'm not a big fan of the baseball field just because of the fence and the wall, and that's a whole nother topic. So I like to think of the door. Like when we're building a door, right? Like it's not a one size fits all. You have to figure out whether you use a doorknob, right? Or a door handle, or one of those vertical handles, or a push bar. What's the other one? A push plate, what's that called? Actuator, or an automatic sliding door. Like you have to figure out, can everybody get through the door, right? And you have, another example is that curb cut effect. How many of you know about the curb cut effect? Yeah, that is a great example, Erica. It was originally designed to make public streets accessible to wheelchair users, right? And now today, everyone benefits from it. You know, you get to folks who are using a stroller or bikes, you know, what is that? Honey can do utility cart, right? So thinking of, that's what equity means to me. It's not making sure that everybody gets the same thing. It's like, you have to really look at your policies and procedures and say, are folks of color, you know, those who are marginalized, are they able to access this? And if so, then that means everybody can access it. So that's just my way of thinking about equity. And then I would invite you all to really push a little, you know, when your organizations are using that term, even DEI, I'm like, what does that even mean? Denise, I know you have your own thoughts about even those three words coming together, but equity is, there's layers to that. And I think there's value in making sure that we all pause, you know, and make sure that everybody understands what that word means before we even start creating an action plan around it.
Right, and that we're all level setting on the same understanding of what that word is. So given that we've kind of given a very high level overview of what equity is, we have two poll questions for you. The first one is, do you currently have the demographic data on the use of your employee benefit programs and services? The second question is, if you have surveyed your employees regarding their wellness benefit programs and services, have you disaggregated that information by race, ethnicity, and language? So just take a few minutes to complete the poll.
And it's not just the EAP program, right, Denise? It's all of your benefits.
Mm-hmm.
Right now, we have about 51% who have voted. So let me know when you want me to close the poll.
Okay. Let's give it maybe about another 60 seconds. It should be good. So Tracy, can you share the results of the poll?
Mm.
So it looks like we have some opportunity.
Yeah.
We have opportunity within our organizations to really look at our benefit programs. So oftentimes we do receive demographic data as it relates to healthcare utilization because that feeds into rate setting for our health insurance. But some of the other ancillary programs that you may be offering as wellness, those often are data is usually not collected on that. And perhaps we're missing opportunities to better slice and dice so that we can really come up with wellness programs that are unique and really fill the need of different communities and communities of color. Toc, I think you had some examples, some stories.
I know, I'm such a storyteller. I'm not linear like most folks in the Western world. So when we were working on looking at the data for our Medicare population, our Medicare and Medicaid community, and they have what's called an over-the-counter card, right? That's a certain amount of funding goes into that card every quarter. And they can use that card to purchase 90,000 different items. And many of these items can be delivered, right? When we looked at the 12,000 members that we have in our system, we realized that only 50% of folks were actually utilizing that card. We're like, this isn't good at all. Like, they should really be accessing those items. So we went out to the Asian community and really talked about the OTC card. And when we shared with them that Tiger Balm and Salonpas, those Salonpas patches were part of the 90,000 items, they were like, oh my God. So they like went out and stocked up, right? And many of them pulled out the OTC card and it still had the sticker on it, the activation sticker. They were like, we just didn't know what this card was. Like, we just thought it was those pretend credit cards, but we still hung on to it just because we didn't know. But this whole time they've had it and they didn't take advantage of it, right? So my point in sharing that story is like, that's what data can do, is kind of help us figure out ways to not just outreach, but also figure out ways to be culturally relevant. Like, I knew that the Asian community loves on Tiger Balm and Salonpas. I knew that that was going to draw them. And then when they saw other oral health supplies and other like incontinence supplies and whatnot that were covered, they were just like, why didn't anybody tell us this? And of course we were like, well, we did. We sent out, letters, and they're like, yeah, not great. And we're learning at CareOregon, right, that sending out letters and putting out flyers isn't the best way to connect and build relationships with our membership. So I just get excited talking about the over-the-counter card.
Yeah, it was a great learning lesson. So we just want to take just a few minutes. We've talked a little, and we appreciate the fact that there's been a very high-level conversation around using an equity lens and the social determinants of health. But we want to provide you an opportunity to talk among yourselves and to really stretch yourself to think about your own wellness programs, and how could they be shaped differently to accommodate different needs and specifically communities of color. So we're going to put you into breakout sessions, and again, we want to challenge you to challenge yourself and your colleagues to pivot and to think about how your organizations have accommodated this new, I call our new normal, living with COVID-19. We started out at CareOregon saying nobody can work from home. You know, you really had to jump through a number of different hoops to be able to work from home and go through a lot of justification to all of a sudden flipping overnight and everybody's working from home. I mean, we had the ability, it was just a lot of barriers to get there. So I'm challenging you to think about, are there things that you may be doing within your organization that you potentially say as no as a block, but if you really push the envelope, could really benefit and service your employees of color, as well as your full employee population. So we're going to put you, I think, in communities of 4 to 5. We're just going to give you just a few minutes. We have some questions for you to reflect on, and then we're going to come back and debrief.
Denise, I'm wondering, I want to ask the group, like, do you all want to do a breakout, or do you prefer to just be here? I think we've got like 30 people on the call now. What do you all think?
Okay, that's fine.
Yeah?
All
Let's
right.
stay here.
All right, so you're going to be brave and you're going to unmute and share.
I see
So
some
we'll start with one
ready.
question. So the first question is, what new policies and procedures have your organizations put in place? In other words, what doors have your organization built and what curbs have they made to be more accommodating in this new modern season of living with COVID-19?
Be happy to share something, if I may. We established a program for our employees, which we call the COVID-19 Caregiver Heroes Emergency Fund, which is a service available to our employees to access funding that could pay for their mortgage, their rent, food, utilities, childcare, car repairs, and any employee whose household has been impacted by COVID, maybe a partner or spouse or anybody in the household has lost their job or has had reduction of hours or has fallen ill, would be able to access the funds. And then we had 3 additional layers to that program. We had a COVID-19 psychological first aid that has been accessed by over 620 people. Again, immediate access counseling related to COVID-19 related psychological stressors. We established a program where we had resource navigators, almost like a concierge service. So right after we closed the states of Washington and Oregon, particularly for childcare and food and access to resources, those resource navigators helped our employees to connect with those resources. And as a Catholic health system, we also have had a spiritual care services, and that has been accessed by over 600 employees. And again, having a capacity to talk with somebody about the stressors that you are currently under.
Great. So as you are making that transition back to office, have there been conversations around what elements would be kept as people move back into an office setting?
Nobody is moving back to the office setting. We are still, well, that's not true because we are a hospital. So we have a lot of people who absolutely work every day since the beginning of the COVID in their regular work setting, caring for our patients. But us administrative professionals, we haven't been at the office since March. And this will be probably pretty long haul before any of us will return to the typical offices.
Okay.
So all of those services continue being available at least until end of January.
Okay. Great.
This isn't a new program, but it's a thought I wanted to share. I know that there are concerns that people of color are not volunteering for clinical trials, and there's a long history of why, which I appreciate. But I think we're going to get to a time where there is a reasonably safe vaccine. And we find out we haven't addressed the racial ethnic concerns about the validity of the research behind it and how it impacts communities of color. And by then it'll be too late in a way. So I'm wondering, how do we open those discussions now about the safety, and how do we find out about the safety of not only the clinical trials, but the actual vaccines that are coming down the line?
And then what avenues do we use to communicate to community so that community feels confident that the information that they're hearing is indeed valid, reliable, and safe, so that there is an element of trust.
I believe OHSU had to suspend the trials because they didn't have enough people of color. And I saw it through the major media, you know, not through the Scanner or the Observer or you know, other avenues to communicate. So I fear that that we need to do more work to make that discussion evenly balanced.
So that communication, well, that trial was suspended not only because they didn't have enough, but it was also the process they used begin to set up that program. So there wasn't real robust engagement of communities of color in terms of how that program was designed and structured. So it speaks back to how do we establish trust? And if I'm going to trust you, I want to be included in that conversation at the beginning, not at the end. And so what processes do institutions and we as employers begin to have with our employees around what really is going to work for them, or in that case, how do we truly engage community so that they feel that they indeed have informed your research processes? Because oftentimes research comes into the community and they lay on the community versus seeking and engaging the community as true thought partners and co-creating. And that does not promote trust. So there's a lot that we have to learn, you know, in those developments. Yeah. Toc, I know you have an opinion on that.
And you know, and I'm looking at the time, I was like, no, I'm more curious to know what other policies and procedures and processes you all have made. Because we're always looking for different ideas too at CareOregon. You all thought we were going to come and teach you. We're trying to get information from you all.
I'm really curious how you all have solved the equity aspect of those employees who work from home and same time trying to care for their children's homeschooling. And oftentimes the telehealth policies are not very inclusive when it comes to trying to multitask as a parent. So How have you addressed that aspect?
You want to speak to that, Denise, or you want me to go?
You can go first.
That's a great question. We're still learning as we go. What I have noticed is that we haven't had it written on paper in any sort of way, right? But we have said, take care of you, take care of family, do what you need to do during this time. And that spoke volumes to so many of the employees at, at CareOregon. So it is learning as we're going. We have an Ask Us, what is it called, Denise, option, where we could send these concerns anonymously. And then our executive leadership is really coming together to figure out ways to support this entire organization of over 1,000 people. So to answer your question, we don't have anything up yet, but I was surprised to see that we, for those who are all working from home, they've included $60 into everybody's paycheck every month to kind of help with whatever you need to pay for while you're at home. So that's one thing we've seen. But in terms of accommodating folks while they're working, we don't have anything written out yet. We're being given a lot of flexibility, if you will.
Yeah, I was going to say, reiterate the flexibility. I've seen a lot more grace in terms of how meetings are scheduled. There's been much more emphasis on supervisors, managers, directors taking the time to engage with their employees, and for employees to have that space to really share about what their needs are. And so that's, again, it hasn't been written. We're not perfect, but I would just, my overarching thing would be there's a lot more grace about how the work gets done.
Oh, Leah, they set up a PTO donation program. We've been wanting that for a while. We'll see if that comes to fruition for us, but that's awesome.
So we have provided some distance learning leave. It kicks in after a number of other leaves, so federal leave, and then we also have a COVID-19 leave that's available. We have flexible kind of telework programs, so supervisors are proactive working with employees and being flexible around what times they work. So if your child performs better from 12 to 3, then don't work from 12 to 3. Put your hours wherever they work best. Obviously, there's some limitations for people who have a lot of meetings, Zoom meetings, which we all. This is great, but it's also one of many that some of us have. So we've also our Healthy Hillsborough program that provides up to $200 for Fitbits and all of those kinds of things. Typically, there was a certain amount that you could spend on certain types of items. And instead, we opened up the full $200, particularly for ergonomic equipment, since people are working from home. We have our public works department took some of people's equipment to their homes. They wouldn't take it into the home, but so like people's chairs, or if they had double monitors and they needed to be able to use one of those monitors or needed their keyboards. And so they would transport those to people's homes so that they would have access to those. So that's just a few of the ones that we've had.
And then we just have a few more minutes. Anyone else be willing to share?
I know, I can't believe it's already 10:21.
Well, I wanted to share that Partners in Diversity, they not often, but they give gifts as thank yous for people who volunteer or do things. And so they've been working really hard to buy gifts from minority-owned businesses. And even if it's small, like bags of coffee from Ian Williams, it makes a difference for his business. So we need to be aware of that.
I think there's the subtle pieces too, right? Like when we talk about grace, I think we're offering that to one another when you're on a Zoom call and one of your colleagues is like hearing a child, you know, in the background, or a dog, or a child jumps on a person's lap, right? Like, I think those subtle things that we've not allowed, but we've given to one another, I think really helps, you know, say like, okay, so you're also having 5 children trying to jump on your lap in the middle of a meeting, and you're not going to judge me. I think those pieces often don't get credit, if you will.
Acknowledged.
Yeah.
So I guess I just want to take the last few minutes and talk. You're welcome to share as well, to thank you for this opportunity to have this conversation, and as you are going back to your employer and you have opportunity to assess or reassess your wellness benefits, that you really begin to think about the needs of your colleagues as they relate to communities of color and language, and to really stretch yourselves to think outside the box. As Toc has shared, one size does not fit all. And this is a time where we really, truly have to extend grace and compassion to each other as colleagues and co-workers. We are all in this together, as you know, the mantra has been, but we truly are all in this together. And to truly be well, we all have to get well together. So again, I thank you for your time. We appreciate it. And Toc, if you have any closing words.
Yeah, I just saw that Simone put in the chat that they also have the 8-hour volunteer time. I thought it was just us, so cool.
Yes.
You could volunteer pretty much anywhere, right? And the organization will pay up to 8 hours.
Our list of organizations was considerably smaller before COVID-19.
Same with ours.
Yeah, it's a much better list and much more culturally specific.
Yeah.
Good.
Well, I mean, just echoing what you said, Denise, thank you for spending the Wednesday morning with us. I think we can all agree that there are, deep-rooted, right, racial and structural inequalities in our system. And there's no moment other than this moment to see that, those gaps, the disparities, and even the ugliness is revealed. And we have to do our part to come up with bold solutions to ensure that everybody has access to healthcare, that everybody feels appreciated and valued when they show up to work, right? Like the African proverb, like, I see you, right? That, I think we all just want to know that we matter. And when organizations can, what did we say earlier before this discussion, Denise, right? The airlines are always reminding us, put the oxygen on you first before you put on somebody else. How are we supporting our staff, our employees, to make sure that they feel good when they show up to work, that they feel joy, so that they can share that work when they're working with our customers and our members. So thank you. Thank you to each and every one of you for spending this Wednesday morning with us.
Yes, we appreciate it. We appreciate it. So I guess we'll turn it back to Mara or Tracy.
Be bold.
Yes.
Be courageous. Push those boundaries.
Thank you, Denise, and thank you, Toc. And I'm sorry, you're going to hear some noise because my water heater broke. So I've been dealing with that this morning. But I want to take a moment to thank each and every one of you for being here. Again, huge thanks to Toc and Denise for sharing their time and expertise. And for all of you, too, for really participating and adding to this conversation about your own experiences. We hope today's conversation will jumpstart changes and long-term impact in your workplace. Understand how health equities impact us all is one step in the equity journey. But before you go, please take a few minutes to fill out this survey. It will help us improve and develop future programs for you. So I believe Tracy will be putting that in the chat box. And we look forward to seeing you all next month. If you didn't get the invite, let us know, but I think Tracy sent them out already. So, and especially get your leader to sign up for the CEO Forum on December 16th. Again, this is for CEOs, presidents, executive leadership. So we really would love to have them there. All right, thanks everybody, and be safe.